It's been weeks and we're still learning new things about the coronavirus. The unknown can cause fear and anxiety. That's why on Fridays, we ask the doctor to get answers to your questions about COVID-19. Dr. Robert Tabali from the Catholic Medical Association joins us now. And Dr. Tabali, the first thing I want to ask you about is a huge concern for me as a mom and all parents out there. The mystery illness that's spreading among kids, which is related to COVID-19. What can you tell us about this disease and what should parents be looking out for?
Well, it's a lot like something called Kawasaki's disease, which is something that's been around for decades, and people have spent their entire career trying to figure it out. We developed appropriate treatments for it, but we never knew what caused it. And it's important to recognize it in your child. Hallmarks are fever, rash, the spotted tongue like a strawberry, possibly some swelling of the hands and feet. And if your child has anything like that, you'd want to bring it to the attention of your pediatrician right away. We're not sure if there's appropriate therapies for that at this time due to COVID, but there's some things that they can do to prevent complications of it. It's an inflammatory syndrome that's mediated through an autoimmune reaction where the body's immune system actually fights itself. So they can do things to interrupt inflammation. We do have a treatment for Kawasaki, which is basically giving intravenous immune globulin, which is very similar to giving the antibodies through donated supplies. That may be a means by which to treat it, but there's no science behind that yet.
Wow, scary. And you mentioned antibodies. So we're hearing so much about antibody testing. Apparently there are different types of tests. So in your opinion, what is the most accurate test being offered?
Well, there's basically two types of tests, two buckets. One is the test to see whether or not you have it right now. That's, I tell people it's kind of like knowing whether you're pregnant right now. The other test is an antibody test, which tells you if you've had the infection in the past and gotten over it. That's the test that I had. I did not qualify for the nasal swab antibody or nasal swab antigen test. So all these tests that are FDA approved, you'd want to make sure they're FDA approved. Ask your doctor, is it an FDA approved test? If they're FDA approved, they have a very high degree of sensitivity and specificity, which means it's pretty accurate. There's one test now that has a very high degree of false negatives, and that's the early test. That's the one that tells you you have the infection right now. It appears that might be actually withdrawn from FDA approval. But there's many different tests being offered, and some laboratories are changing the methodology of the test, even from week to week, of which brand that they're offering. So it's really kind of a moving train, as not really clear what's available. It's not static. It's a very dynamic testing environment right now.
Wow. All right. Now, if you do the antibody test and you test positive that you have the antibodies, what exactly does that mean?
Well, with a high degree of certainty, it means that you've had the coronavirus in the past. It does not tell you whether you are currently infectious to other people. We do consider that if someone is without symptoms of fever, sore throat, and so on for more than 72 hours, that they're no longer infectious. But the only way to know for sure if you're not infectious is to do the swab in the nose or the emerging saliva test. If you're going to have an MRI or a surgical procedure, they will be doing the nose and the swab, or the swab in the nose or the saliva test to look for the active virus in your nasopharynx. They won't be doing an antibody test.
Wow, so just because you have the antibodies doesn't mean that you might not be carrying it. Something to remember. Dr. Robert Tabali from the Catholic Medical Association, thanks so much for being here again.
Thank you very much. Pleasure to be with you.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.